The risk of developing mucositis has both treatment and patient-related factors. You can know what the treatment is and plan accordingly. You need to do a very careful patient assessment to determine the patient-related factors. Age is the first thing to take into account. The very young and the very old are at greater risk of developing mucositis. You can't change age. So that's a patient risk factor that you cannot modify. Other risk factors include their history of oral care, how they proceed with managing their oral mucositis. Those are the things that you really can modify. There is a factor probably related to genetics. We do not have enough information on that. Again, that's not a modifiable factor. Looking in the patient's mouth in terms of their oral health is another patient-related factor. And by doing that, you can decide if there's a need for dental intervention prior to treatment. Another patient-related factor, and we're getting more data on it, is in terms of kidney function, because they have to be able to filtrate the chemotherapy agents so the toxicities do not remain in their system as long. And we also are looking at nutritional status. Now, nutritional status probably plays a role in terms of how healthy they are coming in. The other factor that becomes a challenge in the management of these patients is patients who are above ideal body weight. And are you administering chemotherapy based on ideal body weight or actual? And if you have a mucotoxic agent, that needs to be taken into account.